Hello everyone, I'm Dr. Jiji George, Professor and Head, Department of Oral Pathology, Babu Banarsidass College of Dental Sciences, Lucknow. So today we'll be speaking about viral infections caused by varicella zoster virus as well as Epstein-Barr virus. So coming on to varicella zoster virus. Now we all know that there is something called as a herpes, human herpes virus family. So, varicella zoster virus is a member of the family of the human herpes group of viruses. Now, human herpes group of viruses cause a lot of infections because there are a lot of types of human herpes viruses. So, these kind of herpes viruses cause infections in the humans, and HHV3 is also called as varicella zoster virus. Now, varicella zoster virus very commonly causes chickenpox. Now, chickenpox is a very layman's term, and all of us know about chickenpox because most of us have come across chickenpox some time in our lives, and we know that it doesn't really recur. That's because the secondary infection of chickenpox is called by another name, and it's not very commonly known that varicella zoster virus is the one which causes chickenpox and something called as herpes zoster. So we'll deal about all that today. Now, varicella zoster virus causes a primary infection and a secondary infection in humans. Now, what do you mean by a primary infection? Primary infection is the first time you come in contact with a virus, and whatever infection it causes is called as a primary infection. A secondary infection is the consequent number of times you come in contact with a virus, and whatever different infection it causes is called as a secondary infection. So, chickenpox is actually not a fearful disease because it basically is seen in young children and adults. It can occur at any age actually, but then it can be severe in immunocompromised individuals and infants. So when I say immunocompromised individuals, it can be compromised immunity due to another disease like an HIV. It can be due to a problem of something like a organ transplant, so or any other treatment where the patient is undergoing steroid treatments, or even a simple comorbidity like a uh, you know any other disease associated with it. So a primary infection is followed by latency. Now what happens is there are two types of two stages maybe in which a viral infection can be seen. Now, some of the infections are clinical, that is, you can find clinical symptoms, and sometimes these viral infections are subclinical. When I say subclinical, I just mean that you don't find a clinical symptom in the patient, but at the same time, the patient must have already developed antibodies against that virus. That means the virus has entered the patient's body and it has initiated antibody production in the patient's body. So, a subclinical infection would be the first time maybe the patient has come in contact with the virus. But once after the body's immunity, the patient's immunity has fought the virus off. The chickenpox virus is very peculiar by the fact that it doesn't really leave the human's body. It remains in the human's body. It's just that it goes dormant. It goes quiet. So it becomes latent. So when I say it becomes latent, it stays quietly in the ganglionic neurons. So when it is staying dormant in the ganglionic neurons, it does not really come out of that position where it is latent. So that means our body is not, it does not contain any viral particles when it is in a latent period. Again, later on in that patient's life, whenever the patient becomes immunocompromised, maybe due to old age, or as I said, due to some other viral infection like an HIV, or whatever reason the patient has a compromised immunity, that is when the varicella zoster virus, which is latent in his ganglionic neurons, will get reactivated. So that's another word which we learned today called as reactivation of the virus. So as soon as this virus gets reactivated, that is when it causes the secondary infection. So it's the same virus, but it remains latent in your own body after the primary infection at whatever age, maybe at a young age. And it remains latent throughout the patient's life till it waits till the patient gets immunocompromised later on, maybe at old age or maybe due to other infections. So that is when it comes into play again and causes a secondary infection called as herpes zoster. So varicella virus is a human herpes virus type 3, and it causes two infections in humans, mainly primary infection called as chickenpox and the secondary infection which is called as herpes zoster. So there are certain differences, though it is caused by the same virus. There are some differences between chickenpox, the features of chickenpox and the um, herpes zoster. So we'll come to all of that in detail in this class. So I've already explained about reactivation of the virus. So in immunocompromised states, the virus will reactivate itself. So when the reactivation occurs, that means it's going to basically replicate itself. So if it's replicating itself, it's going to innervate the tissues and the neurons, causing inflammation and death. Right now, there's a pandemic going on, and we're all bothered about the COVID coronavirus, SARS-CoV coronavirus 2. Now, even coronavirus causes inflammation, extreme levels of inflammation in the body, which is what later on causes the death. So if you're able to control the inflammation using drugs and symptomatic treatments, the patient survives. But in cases of comorbidities like a heart condition or a pre-existing diabetes mellitus, so what happens is the patient is not able to take that, the body is not able to bring down the inflammatory process, and that is how the patient succumbs. So inflammation plays a very important role in viral infections. Now, but to varying degrees. So in this case, in a varicella zoster virus infection, the inflammation, it can lead to persistent pain. That is because it affects the neurons, and the nerves, when they're affected, it can cause pain. So that is called as a post-herpetic neuralgia. That means you can treat the herpes, but herpes zoster, the reactivation can be treated. But then, it still remains in the nerves and it can cause problems in the nerves after a secondary infection. That's called as a post-herpetic neuralgia. So the patient would have extreme pain. So that's really difficult to treat. So zoster can also cause a lot of complications. That is your secondary infection. After the secondary infection or the herpes zoster, it can actually cause a lot of complications. That is, it can cause inflammation of the myelinated nerves. It can cause cranial nerve palsies, and it can cause inflammation in the meninges, that is inside the brain. So a stroke can be, the aftermath in the brain. The patient might become paralyzed. Retinitis, that is inflammation of the retina, and gastrointestinal infections like ulcers, pancreatitis, and hepatitis. These are different kind of diseases which can basically come as complications after a reactivation or after treatment of the herpes zoster. So do not get confused between herpes simplex virus and human herpes viruses. So herpes simplex virus is also a type of human herpes virus, but it is a different type altogether. So we are talking about the varicella zoster virus and the diseases which it's going to cause. So it is one of the varicella zoster virus is one of the only human viruses which have very high effective vaccines which have developed. Now, if you compare to the COVID-19, we don't have a vaccine as yet. So that is why the entire world is at its hands. It's not able to. Once you have a vaccine, you are through the disease. Like smallpox is something which we don't have now because we already have a vaccine. So even for chickenpox, there is a vaccine. So people of maybe the 40 to 50-year-old age group right now, that is a generation which did not have a vaccination towards chickenpox viruses or the varicella zoster virus. So in that generation, everybody would have already come across this infection at some time in their lives. But now there is a vaccine for chickenpox or the varicella zoster virus available. So maybe in the coming generations, the occurrence of chickenpox would be much lesser than the earlier generations. So Immunity is developed either by giving them giving a child the vaccine or subjecting the child to the infection. So we in our generation we have already undergone the infection and uh, developed immunity against chickenpox. So the immunity actually remains for a long time until the immunocompromised state comes in. So as far as the patient has good immunity and the general health of the patient is good, the immunity against chickenpox or the varicella zoster virus remains good. But in case the immunocompromised state sets in due to whatever reason, then the immunity does not hold good. Then you have a secondary reactivation of the virus. Now there are two types of vaccines which are available in the market these days. One is to prevent varicella, it's also called as chickenpox, and the other one is to prevent zoster, that is herpes zoster, which is a secondary infection caused by the varicella zoster virus. So varicella DNA can be also transiently seen in the saliva. So which makes it very important for the dentist in for two reasons. So if you're able to develop a kit wherein you can just tell the patient to spit his saliva into the kit, and you can see positivity, you can detect the DNA of the varicella zoster virus, one, diagnosis becomes too easy. The second reason why it is important for a dentist is because when you're a clinician, you kind of get cases and patients really don't know whether they have chickenpox or not till they don't have symptoms. But symptoms develop after an incubation period. So the patient already might harbor the virus and is in an infective stage, and he doesn't know that he has this infection. So he might come to the dentist for a different reason. So there are chances that you might contact, as a dentist, you might come in contact with the virus and develop the disease if you've not come in contact with it before. So, which is why the role of saliva is also very important for a dentist. So testing of saliva is remarkably specific because the DNA of the varicella zoster virus is rarely detected in an asymptomatic human volunteer aged less than 60 years of age. Now, more than 60 years of age, your immunity goes down and there are chances that it can get, reactivated, so you can see it in the saliva. So that's the importance of varicella zoster seen in saliva. Now, that was an introduction to the varicella zoster virus, which causes chickenpox. Now we come to the disease. Now, the disease, which is primary infection, which is caused by the varicella zoster virus, is called as chickenpox or varicella. So you have to differentiate between two things: varicella and varicella zoster virus. Varicella is the disease which is caused by the varicella zoster virus. So these are two different things which has to be understood. So as I already said, the second infection caused by the varicella zoster virus is called as herpes zoster or shingles, or it's like just called as zoster by the doctors. So mode of spread is air droplets and direct contact. So it's a droplet based infection. So you can't come in very close contact to the patient. If he sneezes or coughs, you can catch the droplet and catch the infection. So the incubation period is 10 to 21 days. So now you can actually compare it with COVID-19 as well, because COVID-19 is the incubation period ranges from 5 days to 28 days. Here it is 10 to 21 days. So you come in contact with the disease, and if you don't know, if you're not aware that, okay, somebody whom you come in contact with has a chickenpox, you might not be aware that after 15 days you would get it. But at the same time, if you noticed after coming in contact with somebody that, okay, that person has got herpes or chickenpox, there are chances that you can keep yourself a little on the warier side for the next 15 days. That there are chances that you might develop the first symptom in 15 days. So, how will the clinical features or the symptoms begin as? It would begin like a malaise or a normal cold or a pharyngitis, that is a sore throat, and headache, or you don't feel like eating, anorexia, low grade fever and vomiting. So that is basically how a prodromal symptom in a viral infection would start. Now, common cold is also a viral infection caused by a different type of rhinovirus. So now here, clinical features would always start as a prodromal symptom. You feel very lethargic and lazy, and malaise and tonsillitis. So you just, pharyngizing, you just feel that there is some kind of a, you're going to fall sick, and it's a intensely pruritic exanthem. So when do you understand that, okay, it is something else, it's an exanthematous fever? What do you mean by an exanthematous fever? It means that it's a fever which is associated with rashes. That's what you mean by the word exanthem. So you kind of have a very itchy sensation, in your body. That's when you realize that yes, it could be chickenpox. And it takes a while before the first vesicle comes in. So there's a rash, which spreads to, rash is a red colored area where you kind of start itching. It begins on the face and trunks, and it spreads to the extremities. There's an erythema. Initially there's a redness, which later on becomes a vesicle or a pustule, and pus filled areas. And initially you would start to scratch it because it's highly pruritic, and then you would realize that it just broke down. And it broke down, and then it develops it gives out a certain different type of a fluid from it. That's an exudate. And what's an exudate? It's a fluid which comes out, or a edematous fluid which comes out of an inflammatory process. So this is one of an inflammatory process. And it gives, after once the fluid just oozes out of the pustule, it basically becomes a hardened crust, and it slowly heals. So that healing takes place in a week or so. So it occurs in crops. You find a lot of these small vesicles all over your body, and some of them can have it more on their face. Some of them can have it more on their trunk or on their extremities, wherever it is. So it ultimately causes a lot of itchy sensation. So what you have to do is you have to just isolate yourself for that 7 days or the infective stage, and perhaps take an antiviral drug if at all the infection is too severe. So there is a school of thought that even if you don't take an antiviral drug, you just symptomatically treat the problems, even then, you would get fine in another 10 days. So why is it important for a dentist? It's important for a dentist because the skin lesions might come later on. Maybe initially the patient develops a vesicle inside the oral cavity. Now there's something very, very different or characteristic about a vesicle which originates in the oral cavity, because these oral vesicles can often become ulcers, because you can chew on food, and you can traumatize the ulcer, traumatize the vesicle. So when the patient comes to you, you can see an ulcer, and the patient might tell you that, yeah, there was something like a bleb initially, and which as now I can see it's an ulcer and it pains. So you can think that yes, it was a vesicle earlier, and perhaps it's now become an ulcer. That means it's a vesicular bullous lesion. So you can think in terms of a viral infection by taking a proper history of rhinitis or fever and things like that. So you can find these kind of vesicles and ulcers anywhere in the oral cavity. So basically on the hard palate, and the gingiva, and the areas which are basically very closely attached to the bone. That is where it, not on loose areas like floor of the mouth or tongue. This is where these are the kind of areas where you find the vesicle. So either you see it in the vesicular stage, or you see it in the ulcerated stage. Now the secondary infection caused by varicella zoster virus is called as herpes zoster, also called as shingles or zona. Now, as I said, this is a secondary infection. So there are certain difference, even though it is caused by the same virus, the features are slightly different, because they remain in the ganglions, and now they've got reactivated. So the reactivation can be extremely painful and incapacitating. It will come out of the nerves of the ganglion, and just affect the nerves which that ganglion is a part of, and it would just affect that side of the body. It will be unilateral. So you can see that the vesicles develop in herpes zoster as well, similar vesicles like a chickenpox, but it does not basically develop in the entire body, but it just develops in on that side of that of the face where that nerve is supplying. So it would be just till the midline, and it would not cross the midline. So you would find a lot of these small pigmented areas, pigmented lesions and vesicles just till the midline of the face, never crossing the midline. So the pain and the post-herpetic neuralgia and everything will be limited to that area of the face, and not the rest of it. So as I said, it's caused by reactivation. So the prodromal symptoms are the same as that of the chickenpox. It's just that it is dermatomic in distribution and it is unilateral. Dermatome means it is that area of the body which is just supplied by that particular nerve. So if it's a trigeminal nerve, you can have it affecting the areas which is supplied by the ophthalmic, maxillary, and mandibular divisions of the trigeminal nerve. So painful vesicles can be there, which can, similar to the chickenpox, can kind of break down and form ulcers. Now, there's something called as the James Ramsay Hunt syndrome, which is associated with the zoster infection, where geniculate ganglion is involved. So when that geniculate ganglion is involved, you have the external ear and the oral mucosa being affected. Also with a Bell's palsy, a facial paralysis, and pain of the extra auditory meatus or the pinna. So the patient will have severe pain in the external auditory meatus, a facial paralysis, and one side of the face will be affected with the geniculate ganglion getting involved. So that is called as a James Ramsay Hunt syndrome. So this is how exactly the lesions would look like. The picture above, you can see crusted lesions in some areas, and the vesicles are in crops. It's in clusters. It's together in an area. And on your right side, you can see the face of a patient wherein only one half is affected. The other half is perfectly normal. That means it's a secondary infection, and only the nerve on that particular side is affected. So that's very particular about herpes zoster. So it can give post-herpetic complications like during pregnancy. If the patient has developed any of these varicella zoster infections, it can cause neonatal chickenpox because it can cross the placenta. And in immunocompromised patients like HIV patients and organ transplant patients, it can cause severe infection, and complications can be bad, leading to superadded bacterial infections as well. Now, diagnosis is important because clinical symptoms are extremely important in diagnosing chickenpox or herpes zoster, because you should look at the vesicles and the timeline in which the vesicles developed and they have formed these kind of problems. And secondly, also history of exposure. If the patient gives you a history that yes, I came in contact with somebody who had chickenpox, which I didn't know, I got to know it later. That's a history. Then the patient can even tell you that inside the oral cavity, initially he had a vesicle and then it broke down and formed an ulcer. Or you can do a Zang test. A Zang test is when you take, um, you know, the smear from a vesicle or the area surrounding it, and you just stain it with HME and see under a slide, a cytological test. You would find Zang cells. Zang cells are those acantholytic cells which are part of the stratum spinosum and are not attached to each other by any cell junctions like desmosomes. So you would find these typical Zang cells in lesions like other vesicular bullous lesions like pemphigus. So it's not characteristic of the disease, but then yeah, it can be seen in these viral infections and as well as in pemphigus vulgaris. So virus isolation can be more in cell culture is more specific, that can basically detect the virus. Then you can also do fluorescent antibody testing because you find an increase in antibody titer in the sera. So antibody testing is very common these days, especially in the pandemic due to COVID. So similarly, you can do it for this virus as well. Now, coming on to the next virus for today, I'll be discussing about Epstein-Barr viruses. This is also part of the human herpes virus families. So this is a virus which can cause certain diseases which are neoplastic and some of them which are non-neoplastic. So I'll be dealing with two of them importantly here. One is infectious mononucleosis, which is a non-neoplastic and a self-healing infection. Most of the viral infections are self-healing, but then yeah, it can also cause a neoplasia, which is not very nice. That is Burkitt's lymphoma. So Burkitt's lymphoma I would discuss Burkitt's lymphoma in lymphomas, and but then it is caused by EBV. So it's an overlapping topic. So I would only mention the name over here. So it causes lymphoproliferative diseases due to a chronic EBV infection. So that is Burkitt's lymphoma, which is a type of a B cell lymphoma or a non-Hodgkin's type of B cell lymphoma. So EBV can also cause nasopharyngeal carcinomas, that is cancers of the nasopharyngeal region, and it might not be the only cause of the disease, but then it can be an adjunct factor. So otherwise, it causes a non-neoplastic disease called as infectious mononucleosis, and as a dentist, it's very important to know about it. Otherwise, EBV causes a lot of other infection, But then for us, it is more important to know infectious mononucleosis because we see a lot of patients with those diseases in our clinics. Now, the symptoms may kind of, usually resolve in a couple of months, and it also might remain latent in a few cells in the throat and blood for the rest of the life of the patient. So it can also be detected in saliva at times. So coming on to infectious mononucleosis, also called as glandular fever. Now, EBV is also called as human herpes virus type 4. So the varicella zoster virus was called as a human herpes virus type 3. Now, this is called as HHV4. And infectious mononucleosis is also called as glandular fever. It spreads by direct contact, that is deep kissing. So it's also called as kissing disease, because deep kissing between two people, if one person has an EBV infection already, he can transmit it to the other person. So that is how, you find sore throat and vesicles on the throat. And these are all self-healing lesions. The patient can come with a common cold kind of, symptom like a rhinitis and a fever and non-specific symptoms like these. And young adults are symptomatic, and the childhood exposure, they might not be symptomatic. So other diseases which are caused by EBV, which as a dentist you should know, are oral hairy leukoplakia. And I already mentioned Burkitt's lymphoma and nasopharyngeal carcinomas. Now, clinical feature, it would be, since it affects the upper respiratory tract, it would have fever, lymphadenopathy, these are prodromal symptoms, and pharyngitis, tonsillitis, and rhinitis, which again affects all the pharyngeal areas. Hepatosplenomegaly is not, and cough, basically cough, yes, but hepatosplenomegaly might not be an interest to a dentist, but then with the other features, you can still recognize the disease as a infectious mononucleosis. So I've already discussed this prodromal symptoms. Prodromal symptoms are those which initially come in place of a viral infection, and a day or two, then the full-fledged infection would start. So that's how you see petechiae or pinpoint hemorrhages in the soft palate. So this can be due to either oral sex or deep kissing, and this is how you exactly see these lesions, and they become self-healing lesions. So lab investigations are important in case of Epstein-Barr virus infections. Atypical lymphocytes might be seen in the circulating blood, so you can take a peripheral blood smear, because circulating blood can be visible through a peripheral blood smear. So the diagnosis is pretty easy. Or you can do an antibody to EBV. As I said, antibody tests are very common now for viral infections. So they're more specific, and they'll tell you specifically what kind of a virus it is. So also the specific test which you can do for an infectious mononucleosis would be Paul Bunel test. That shows an increased heterophil antibody titer. Then you will have increased WBC counts, which is again a very non-specific symptom, and relative lymphocytosis. That is, lymphocytes would be increased relatively with other WBCs like neutrophils or monocytes and all that. Or an ELISA. ELISA is a enzyme-linked immunosorbent assay which can be used in many other, viral infections. So that is about today's class about the EBV infections, Epstein-Barr and varicella zoster virus infections. Thank you so much for your patient listening.